Hi, everyone. I'm Michelle Crawford, and welcome to Michelle Crawford Presents, the podcast about cannabis lifestyles and living your best life. Today, I'm so excited to bring someone on that I know from Cannabis Coaching Institute and whose other talents and endeavors in life can help you to lead a much more pleasurable life than you may be currently living. I'd like to introduce Dr. Norelyn Parker. Norelyn, would you like to come in and say a little bit about yourself for the people?
Yes. Thank you so much, first off, for having me. I was really thrilled when you reached out, and I'm so excited to be here today and have a chat. So, yeah, my journey through cannabis honestly starts through sex coaching. I am a certified sex coach and clinical sexologist. So, I'm certified through Sex Coach U and Dr. Patty Britton's program there. And I'm also currently the general manager of SCU. So after graduating probably a decade ago now, I kind of circled back around home, and now I'm on the staff there and I'm part of the faculty. So it's really, really special. But from being a certified sex coach, I throughout my journey there, I thought, okay, I'm going to work with people and their sexual health and wellness. And in the midst of that, I found myself in a journey of a diagnosis of an autoimmune condition. So I was diagnosed with lichen vulvar sclerosis. And despite having relief that I had a diagnosis, there was a huge hole that was left that the medical team could not help me with, which was navigating the knowledge that I have a chronic health condition that is incurable, and it's an autoimmune condition. And so there was just a lot of things that come around with that, and pretty directly because of the part of my body that this affects is my vulva and chronic pain.
Oh, God.
And I thought, okay. And I wished I had a diagnosis a decade earlier, because a lot of what I seen was the architectural changes and damage was done, so to speak. So I left my doctor's office in tears with a prescription to go pick up at the local pharmacy and an inability to talk with my partner and navigate that. And I thought, but I'm a sex coach and I'm sitting here with shame and pain and confusion. And I could only imagine somebody without a background in sexual wellness, what they're going through. And I was really, I hate to say it, but kind of appalled at the hole in the medical system.
Yeah.
Where you're giving a diagnosis to a female patient, and here's this ointment.
Bye.
Yeah.
Go live a great life. We don't need to support you any further. Are you joking? I mean, it's like tearing, but I'm laughing, but I'm tearing.
Yeah. I was like, okay, so what's the future of my sex life? And
that's terrible.
I know, it's bad. I was like in the stirrups, like laughing maniacally, because I'm like, this can't be happening, right? So I went through these stages of acceptance and anger.
Yeah.
And all of that. And when I came out on the other side, I said, what might be able to help me? And I wasn't a big cannabis user. I honestly was somebody who was very neutral. My partner grows, my partner is a consumer, but I have always been of the nature of, I'm too sensitive for cannabis. I've had that experience of getting too high, and I didn't know about the world of topicals. So
yay!
that was my entry point. So I explored vulva balms that were cannabis infused, and that got me on a pathway to recovery that got me into remission. Now, I definitely followed the treatment recommendations from my doctors. I always recommend you go with that. But what I found is when I built a medical team that supported my cannabis use, while they could not speak on it themselves, they were in support of it.
Yes.
Keep doing what you're doing, because we see it's working.
Oh, hallelujah, Norelyn. I thought, hallelujah. I love that. The combination, as a cannabis health coach myself, as you know, I'm never against, Western medical care. I feel like we have the partnership, like better living through everything together. You know what I mean?
Yeah, yeah. And once I had that green light, that support, and I could track myself,
Mhm.
which tracking was a little overwhelming at first, tracking the symptoms, and I found, well, once I get into a habit of it, I could really see that it was mitigating the symptoms and also just extending the time between needing the other treatment. So I was sold. And I was like,
Yeah.
how do I learn more? And how do I bring this to other women and couples and their partners or partner, all of the above, and help them navigate a diagnosis and bring their medical teams together? So I looked towards CCI, the Cannabis Coaching Institute. Yes, got a rep. And yeah, I just dove in and I
Good.
thought,
I was there.
yeah, I didn't, I just dove in and I didn't really see the two sides of my professions mixing yet at that point. I thought, all right, I'm going to have this lane. I'm going to have the clinical sexology lane, but there's a way to merge them, and I'm leaning into that. And the more I started dipping into that in the clinical sexology, people had questions. They were like, wait, first of all, you can become a certified cannabis coach. What?
First of all, wait a minute. Yeah, wait. First of all, that's a thing. You can become, I mean, with you, I want to say you can become a clinical sexologist, number one. And then number two, you can become a certified cannabis health coach. Yes, at Cannabis Coaching Institute, where we both did that. So let's get that out to the people. It's
Yes.
a thing, people. And look at how amazing it can be. Continue, please.
So I just started sharing a little bit in the sexology realm. And then I also started sharing in the cannabis realm, this other hat I'm wearing. And I just really decided, you know what? I'm going to lean into CannaInfused pleasure coaching, which is what I'm calling my program. And I'm starting to present on the topic more regularly. And I thought, well, what did I do to help myself? And I took the MEBS signature system, which is from the sex coaching, and that's taking yourself through an assessment of mind, emotion, body, energy, and spirit. And all of that with the lens of sexual health and your goals. Where do you want to go? And the action plan to get there. And that's what I've helped my sex coaching clients with. So I just did that process on myself. And then I overlaid the cannabis coaching and I went, oh my gosh, this is how I can approach so many, not just support through a chronic illness, but enhancement and beyond.
Yes. Oh my God. This is why I do this. It's because people need to know. Norelyn, people need to know. They don't. So you found a way to wear both hats at once, to put the cannabis flat feather in your hat, flower in your hat of sex coaching. And I think that's beautiful and the way you described what you do in terms of an intake on yourself or with a client, looking at your life, taking an assessment, thinking about your goal and making a plan to get there. Your sex life is just as important as any other part of your life. If you need a business plan or a learning plan, or even a plan to just fix your house up or something like this, or a plan to do a YouTube podcast or whatever, I really appreciate you coming on here and telling the people what it's like to make a plan for your sex life, which is a very important thing. And then to hear how you took your experience, what happened to you. We're our own healers. And then when we share our own healing, it heals others. So what you're doing to me is just natural, perfect. The most beautiful outcome, I think, of everything you put together so far, and even your diagnosis and your life experience there, which is not to say great, right?
Yeah, yeah. There's a lichen sclerosis support group for a reason. And I found that space so valuable when, again, I went home and despite the fact that I have an amazing supportive partner, I was like, what do I do? What do I do with this? How do I heal myself and heal my heart space and look towards the future? And groups like Sclerosis Support Network, really, really helpful. But also, when I started talking to them about cannabis, they have lots of questions too. So there's all these spaces that are really curious about cannabis, but don't really yet know how to work it in. And I just did a local search, and I'm in the Sacramento area, and I thought, let me look at what's the vibe in the holistic wellness centers or holistic coaching counseling centers where they list, hey, we're holistic. That means we
Cover
cover
more
all
things, the
bases,
whole person. Yes.
but
Do they?
they don't have sexuality experts. And then they don't have plant medicine. And then, so it's like, hey, I need to start talking. And that's where one of the reasons, of course, I'm so excited to be here. And I'm still putting feelers out and really figuring out how to bring this together. But that's my intention with my coaching practice. I'm figuring out, my goal is to have a 8-session package that can get somebody set up with their cannabis goals and their sexual wellness goals, set them up with tracking, set them up for success, and also to address bringing in their partners into it. Because with cannabis, despite the fact that we're in California, there's still a lot of normalization and potentially tensions that exist between two people in the conversation about cannabis. So I'm really passionate about bridging that gap and having those tough conversations too.
I couldn't love it more. Norelyn, that's beautiful. I remember when I first started out, I would talk to my friends about it who were mostly women, mommy types with families. And slowly but surely, like little things would happen where maybe I would get the husband's ear for a minute. And like a lot of the story, like your story with your partner, the one partner is into it, cannabis, that's what I'm talking about.
Yeah.
And the other partner's like, nah, it's okay, not so much for me, or maybe. And it's surprising when I tapped into the other half of the couple, the one that was into cannabis, how much they wanted to share it with their partner who wasn't as interested, and how much they kind of had this, I wouldn't say fantasy, but maybe a wistfulness inside of them to
Yeah.
share that part of their lives more fully with their partner. And I didn't know what to do about it at the time. And I still don't know what to do about it. But hearing that you're focusing on that and bringing that into the light a little bit more is good news to me, because I know it's needed in the world. And you do too, I can tell. Yes. So CannaInfused pleasure coaching. I'm reading like the notes that we took in preparation for our interview today. I'm curious, like, can you go over a little bit more about what are your plans for the 8-week, what people would experience if they did it with you?
Yes. So I'm looking at going through that MEBS signature system, that model. So that's going to be going through mind, emotion, body, energy, and spirit. And I want to underline the collaborative process that this foundation of sex coaching in this client coach relationship is, because sex therapy is out there and there's definitely a great need for sex therapy, but we differ a little bit in the collaborative nature and also really looking forward to those goals. So first setup, we're going to look at the MEBS model and look at that assessment and really unearth the goals you have. Because many people arrive to me, whether it's cannabis goal or sexual wellness goal, and they have 2 or 3 things they're working on or looking towards. But usually in that conversation, those initial conversations, more things come out. And that's a really beautiful process. And that's where I really say it's collaborative. And then on the cannabis side, we talk about their past experiences, potentially any myths they have, misinformation, and make sure we're starting in a grounded space that's based in science and resourcing my clients. And also framing what mindful cannabis use is to them. I think it encompasses a couple of elements. One of them is setting your goals and connecting that to the ingestion methods. Another aspect is prioritizing consent, especially if you're going to consume with even your partner, your long-term partner. Bringing that consent conversation up can be really healing and empowering. And then
also
we go
sexy. I find it
and
sexy and
sexy.
flirty.
Yes, I
Come
love that.
on. The consent conversation, especially between partners, can be very flirty and fun. And what partnership, especially a long-standing one, doesn't need flirty fun times? So good if you're new
Exactly.
partners and good if you're old. Consent.
Yes, it doesn't have to be this dry space, for lack of a better word.
You said
Pun
dry.
intended. Yeah. No. So, and like as a little teaser, if you see back here, I've got some
I'm so
fun implements. So I also incorporate into cannabis pleasure coaching the realm of BDSM and exploring that way. And there's lots to be learned from this realm in terms of consent and having that conversation and making it fun and sexy. So everything in between. So throughout those 8 weeks, this is just some of what you're going to learn. A lot is going to be about your unique endocannabinoid system. That's getting lots of buzz and has been for a while, this ECS, your endocannabinoid system. Well, many people don't know that every person's ECS system is different and shifts. The tone of it shifts throughout the day, throughout what's going on in your life. If you're a female-bodied individual as well, hormones play a part into it. So I just see light bulbs going off with just the excitement of being like, wow, I have some control over how my ECS system is and how that tone is. And that undocks a lot of the fear that people have in terms of looking at and labeling different ingestion methods and different strengths and potencies. That was one of my biggest fears. I'm like, 1-to-1, 2-to-1, what does this mean? And even your best dispensaries, the bud tenders, they're going to be really informative, but
are they going to want it? Are they going to do? No. It's highly specialized. I don't think you're finding this in every dispensary.
Yeah. So this is where I hope to, throughout an 8-week program with a couple or an individual client, to really bridge the gap, give them the tools to do their own tracking, to have fun with it, to not get caught up in the packaging of a product, take it home and find out it's too overpowering, and also figure out a way to do all this in a financially supportive way.
Yes.
Too, and talk about potentially creating your own products or how to get the bang for your buck at a dispensary. There's all these tips. And I mean, just to show the possibilities are endless. I mean, this can be within the realm of your own private life, or this could be talking about setting up your own pleasure party experiences with cannabis.
Oh, yes.
So
Pleasure party experience. Yes. SAC is not too far from me in San Jose, and I have a new possible client out there, so we could hook up and talk about this more. I'm excited. Pleasure party me. Look at all your fun toys. Who doesn't want to go to a pleasure party? Okay, you mentioned at the very beginning cannabis topicals for this, and I have another client and student who is dealing with a sort of like an inflammation of her genital skin that is a problem. I don't remember her diagnosis, but luckily she's already a Cannabis Coaching Institute graduate, so she's kind of already leaning into that and using both Western medical medicine and this together. However, when you said topicals in the beginning, you really lit me up. So I love to teach and preach about making your own cannabis suppositories, making your own weed lubricant, infused oils for sexual, purposes. And I need people like you to talk more about that out there in the world so that, one, people, mainly women is who I'm thinking, can experience the heightened pleasure and sensation that's available to them when this is what got me into it. I'm sure you know, but it was How Your Pussy Got Stoned with Weed Lube in Vice. You remember this article?
Mm-hmm. Yeah.
That's my story. I read that article and I was like, yes, please. Let's find out more. And then, yeah, I've been living that life ever since. And now we're here. But I need you to talk about it now. I need you to tell me what your thoughts on topicals are for like someone dealing with something you're dealing with, maybe something my friend is dealing with. I mean, I know you're not going to medically talk about that, but or just an average person, what's available to them? Why should they have hope about bringing cannabis into their sex life for better pleasure and healing?
Yeah, yeah. And I'll start off by saying conditions aside, vulva bombs and lubes aside for just a moment, vulva bombs are just a really amazing thing to use on a regular basis. I mean, the way we look at facial skincare, right? I think,
Right? Yes.
and I'm not talking about the vulva from
And then like the skincare,
yeah, the skincare. And I'm not necessarily talking about the comparison in an aesthetic point. I want to make that clear. I'm talking about just the health, because as an example, and I can't tell you, 9 out of 10 women that I tell this are surprised, but the risk of hood fusing to your clitoris over time without any conditions is rather high. So it's really important for you to always retract your hood during those self-pleasure sessions, consciously retract it. And what can be really helpful is getting that cannabis balm underneath the hood.
Under the hood. Wow. Under the hood. This is a whole new thing in my mind. It's, you know what I mean? Like low rider under the hood.
Let all the images come to you.
Yes. Look at my mouth like,
yeah. So it's just like at a base level, I think that's really important for the health of the tissues. And then you tack on the pleasure and throughout the cycles and how your body changes throughout the cycles. And so then when you take somebody who's dealing with rounds of chronic inflammation, like with LVS or other conditions that affect the vulva, steroid creams are going to be really helpful to take that inflammation down and keep you out of remission. And one of the things that people fear about the steroids is that it might thin the skin over time. And that's if you use it, overuse it. So that's why you have to really just use it recommended by your doctor. But what happens in between is that cannabis can just help out with times in between when you're exercising, being physical, just in a real general sense, and it really cuts down on that inflammation. So then you lean into that pleasure realm and you lean into things like cannabis lubes, cannabis infused products, and treating it like a marinade.
Okay, I won't interrupt you. You're on the best part.
You're good.
You're on the best part.
Yeah. Yeah, treating it like a marinade and having that moment, if you have the time. Some of these unplanned sexual experiences, they're often going, but if you have the time to marinate 20 minutes, 30 minutes before that sexual experience.
Make the time if you can.
Yeah, make the time. Make the time.
Take the time.
Mm-hmm. And you really allow the CannaInfused product to soak into the legs of the clitoris and the vestibular bulbs and have that increased blood flow and relaxation. And if you're coming from a place where you've had a chronic condition and even if you've been in remission for months, what I personally find is that I did have a lot of trauma. And even though visually I don't see inflammation and I've gotten great reports from my doctors, there's still something holding on and a bracing for pain that I really couldn't let go of until I turned to cannabis.
I see. Yes, that makes a lot of sense. When you get an injury, for example, I can relate to this from like an ankle, for example, and you hesitate to really put all your weight on it. Or I'm a big sports fan and you see these NBA and WNBA players get an injury and then they can't quite perform because they don't trust it. You know what I mean? And so you can't quite go there because you don't trust that you're not going to get hit by pain. And so cannabis helped with that, is what you're saying?
Yeah, so the topicals was the first layer, and also suppositories, another layer, right? And getting that deep internal relaxation, sending that somatic signal up to my brain, and then adding on when I've needed the extra support, the in the moment dose of either
Inhaled.
dry herb vape, yeah, or sublingual, depending on, and this is where that conversation becomes really specific in cannabis, CannaInfused pleasure coaching, because that edible might, that edible might hit after the sex party, after.
This is basic cannabis education here, that this edible needs to have been taken. Like, if you didn't have time to marinate, you didn't have time for an edible. Like, come on, like that's a plan ahead sort of thing.
Yeah. So when is it that dry herb vape? Is that the best option when you're looking to get the terpenes that are too volatile for a joint? And so we can get really specific if we want to and need to support that cannabis experience. So topicals, and then suppositories, and then ingestion that had immediate effects, so I was ready to go, really worked wonders at finally breaking the loop that I was in.
Yeah.
It's going to be painful, and just trying to bear through it because I have a partner, and I was like, well, I trust him and I'm just going to bear through it. No,
that's not CannaInfused pleasure at all.
no. And that's where I think, yeah, that's why I'm so passionate about this work. And I'm really looking forward to launch that 8-week program. In the meantime, though, I've started hosting a CannaInfused pleasure workshop that I'm hosting again this month. So for the second,
how does it work?
I'm really excited for it. Huh?
Yeah. Tell us how it works. Is it online? Is it in Sacramento? What do we do?
Right now, it's all virtual. I'm putting some feelers out to see how I could do this in person. But luckily for anyone watching this anywhere in the world, you can register online. And so it's a 2-hour workshop where we're going to go through some foundational aspects of how to select the right products, learning what affects your endocannabinoid system and tone. Again, those ingestion methods, but I'm going to go to some really creative spaces too and talk about things like the difference between bliss and excitement and arousal and pleasure. Like all 4 of those words we all have heard many times, but when you put them together, you realize they're all slightly different. And they all have different effects on the body from a physiological sense, and how to become sensitized to it and how cannabis fits into that. So I'm really passionate about talking about that. I also talk about awe, the new science of awe and creativity. And what we know about cannabis, one cool thing is how cannabis affects the amygdala, and that lowers the threshold of what can trigger our sensation of awe.
Really?
Yes.
This is so awesome.
So when I learned that, I thought, oh my gosh, so this is why that piece of pizza you're eating when after you've ingested cannabis, you have that sense of awe about that piece of
wow.
pizza. So I'm like, well, I want that when I taste my partner's body.
Yes.
I want that when I'm conjuring up this fantasy that I've used 20 million times.
Oh, yes.
But I want it back, and I want it to taste fresh and awe. And there's so much power in that. So this workshop goes into that, goes into how to throw your CannaInfused sex party, and plenty of time for questions. So it's something that I'm really excited to be invited again to present. And it's through a dear colleague of mine. Her group is called the Pleasure Union, and you'll also be able to find the link with this video. So the Pleasure Union, it's a really unique community of supportive people. The people running this, they're certified sex coaches, and they have created a curated collection of events that build your knowledge and skills and have you connect all around the word pleasure. So as an example, there's creative writing for psychosexual exploration.
Oh my
There's
gosh.
communal pleasure practices. There's advanced consent skills workshops. There's me talking about cannabis. There's sex magic. I mean,
Sex magic. Yes. Let's go there more.
it's more of that. So
do more. Let's do more.
it's a really special spot. So the cool thing is, if you're not a if you become a member of the union, you get access to all of these whatever is happening throughout that calendar month, and as long as your membership continues. But you can join my workshop, for example, and other workshops ad hoc, and then you get a taste of that community and network, and totally welcome. So there's some options to sort of check out the Pleasure Union, or just come and learn about sex.
You can figure it. You can visit Dr. Norelyn. You can get cannabis infused pleasure coaching, and then you could stick around for all that sex magic and everything else you said with the Pleasure Union people. That's awesome. More people need to know. That's why we're doing this. Yes, yes. Or maybe, as they say, yes.
Yes.
Come to the Pleasure Union. Oh my gosh. Anyways, you know what, having you on is it's pleasurable for me. It's like, not only is it pleasurable because you're beautiful to be with here in this space, it's pleasurable because you're helping me with my goal of helping more people to achieve pleasure in their lives through sex and cannabis. And I appreciate that so much, and the work you're doing. I think you are so special. I think what you're offering is really needed. I think more people need to know about it, and that it's unfortunately not as common as we'd like it to be. I would love for there to be 1,000 views, but I think there's only one. You know what I mean? And you can only do so much. So if people need to get with you and you're hearing this right now, take action. Look at the links down there. I will put this on YouTube with everything, so you can reach Dr. Norelyn and Pleasure Infused Coaching, as well as Pleasure Union over there where she's at in SAC, and online. So it's available to you. Is there anything else that you wanted to mention before we wrap up for the people, Dr. Norelyn?
Oh gosh.
If you don't have a question, I'm going to say, what's your favorite toy from the wall? Show it to us.
Oh my gosh. I would say that, like, you're in charge of your own pleasure. And if any of this resonated with you today, I just want you to hear that you are in charge of your own pleasure, and you're at the start of an amazing journey. So I'm here for any questions that you have. I've loved to meet you. And my favorite toy on the wall.
Your favorite toy on the wall.
Oh my God. I mean, there's like an interchangeable flogger that is amazing. It's got different kinds of, yeah, I don't know. That's one of my favorites. And I love these. Shall I go?
Platter of flogger.
I'm like,
the floggers.
Let me see.
Look at you.
These are metal nipple clamps.
Yeah.
That look like clothespins, and I just think they're so fun.
And then there's the fact that they're attached.
Yeah, these.
Oh God.
So yeah, I love me some sensation play. So.
Oh, that's so sexy. Yes, yes. Okay, well, I definitely want to find out more about your pleasure room over there these days. All right.
Thank you so much for having me.
Oh, it was a pleasure.
We can't help it.
Obviously. It was a pleasure to have you on, and more people need to know. I've said it 7 times, but thank you, Dr. Norelyn, for coming on and talking to us about everything that you're doing. I really wish it the most success. I hope to have you on again. Maybe we'll catch each other in Sacramento, because I will be headed there a little bit, and that would be fun, right? Awesome. All right, well, let's tell the internet goodbye. I like to give them a kiss. Mwah! Bye, internet. Thanks for joining us.
Bye.